Good evening, everyone. At the outset, I'd like to thank all the office bearers of AIOS for inviting me here. In this small presentation, I'd just like to discuss how the findings of the AIOS study compare with other studies, because I've heard there's a lot of controversy or there's a lot of anxiety related to the findings. So if we look at the study, what is the study basically suggests is that about 1/3 of the ophthalmologists have depression, most of which is mild depression. And this depression has been assessed by using PHQ-9, as Dr. Santosh discussed, which is an instrument basically used for screening and diagnosing depression. So let's see this slide. How does it? This is the finding of the AIO study, and this is another study which was done by us, in fact, during this COVID time period. So when we compare the rate of depression in our study and that AIO study, we can see that these findings are almost comparable. So when we say this healthcare worker, it has people from all the specialities. It is not just limited to ophthalmology or any single specialty. So I just want to emphasize the fact that the prevalence of depression at this moment in ophthalmology is similar to what other healthcare professionals are encountering. However, when we compare this with the National Mental Health Survey, which is basically done by using a diagnostic instrument, the prevalence rate of in which is about 3%, these findings are much higher. Then the other finding is that depression is more common in young people. So again, I compare this with one of the study which was done in our institute about a year back, where we had looked at depression. At that time, we had found depression in about 30% of the residents. So when we compare that finding with the AIO study, the findings of AIO study are lower. And depression is more common in females. This is well-known fact because of the dual role they play. So again, the AIO's findings just supports this. And about the risk of suicidality, again, if you compare with the National Mental Health Survey, which reports about 6% and about 0.9% in higher risk. So again, the findings of AIOS are again very comparable. So they're not very high compared to what we see in the general population. So when we look at how do we deal with it, any kind of mild depression which is there, we don't require any kind of intervention immediately, but a small amount of follow-up is required. Those who have moderate or severe depression may require some amount of evaluation, and if the diagnosis is confirmed, they will require further treatment. So this is what we need to understand. The mild depression we don't need to treat. So what we understand from this whole study is that in AIO study, most of the depression was mild depression, which may be a kind of adjustment disorder, which do not require immediate clinical attention, but a follow-up may be required. 11% of the participants had depression, which requires clinical attention. And this prevalence rate is higher than the normal time seen in general population. And figures are, however, the figures are comparable with other healthcare workers evaluated during the same lockdown period. And the figures of suicidality are comparable to the general population. So ophthalmologists should not get scared by these figures and should not feel that they are alone. Big celebrities have gone through depression. It's not something that ophthalmologists are going through. Anybody can go through depression. So we should always stand up and speak about depression and if required, seek treatment. So that's where I'll stop. So I'll just advise, relax, don't worry about the findings which are there. That's not something which is very startling that you need to worry that ophthalmologists are going through very different kind of reaction which other specialties are not going through. Thank you.